I want to welcome everybody to the February 2024 meeting of the Parrot Club. We're excited tonight to have Dr. Kristin Sinclair with us. Dr. Sinclair is a frequent speaker to our club on a variety of health-related topics and is one of our favorite speakers. And Dr. Sinclair, for those people who don't know, is a board-certified avian vet and one of the principal vets at Kensington Bird Animal Hospital. And with that, I will turn it over to Dr. Sinclair.
Thank you, Amy. All right, so tonight's topic is going to be foot health for our little bird friends. It's a subject I find myself lecturing about at least a couple times a week, so it's definitely a problem we need to be aware of. So we're going to break it down into basically, I'm going to start talking about the anatomy and adaptations of bird feet for their various life processes, and we're going to talk about the types of foot problems we most commonly see. We're not going to be talking about every possible foot problem, but certainly the most common ones we run into. And then we're going to go into the treatment and prevention of these problems. So with bird feet, foot health is important because, well, they only have two of them. Most birds are not meant for one-legged living. We don't tend to see too many one-legged chickens or hawks out there for very good reason. If you're a tiny little goldfinch, you could probably handle it, but other than that, they don't work terribly well as little peg legs. Most birds cannot afford to lose a foot or the functional use of one foot, much less both feet. So it's important we keep those feet as happy as possible. You'll read online about prosthetics and birds' feet. You'll see feel-good articles about, hey, this duck that's got a prosthetic foot or this rooster that's got a prosthetic foot. It's rarely as easy as it sounds. That rooster probably had at least 10 prototype prosthetic feet before they settled on one that functions well for it. The way that our parrots' feet in particular move, that's really hard to replicate with a prosthetic, and often it doesn't work unless you are a rooster that's relatively sedentary and not tearing around the yard. Larger birds in particular tend to be crippled by foot problems. They've got heavier bodies, so just much more weight being borne by those feet, and it's harder for them to compensate. Small birds can manage okay with missing toes or feet. If you do enough wildlife rehabilitation, for example, you're going to meet some little finches and such that have only one foot. They do okay because they weigh all of 15 grams, whereas a 1,000-gram macaw, they'd be catastrophically crippled by the loss of a foot. The impact of foot problems really depends on the species and the body type of the bird. For example, the parrot, as we've probably all seen with our little friends, they use their beak like a fifth appendage, and they can fly, so they actually can get around pretty well using methodologies other than their feet. So depending on the size of your parrot, they might be okay with one problem foot. They can hold themselves up with their beak, they can fly from place to place. That said, again, the bigger the bird, the bigger the problems, not only from a weight-bearing standpoint, but those larger birds often like to eat with their feet. The macaw will pick up a food item and hold it in its foot while it eats. They're not really ones that tend to just stuff their face in the bowl and eat like that. If you have a foot that doesn't work so great, it makes it really hard for a larger bird to eat. With chickens and ducks, they tend to have a more horizontal body orientation than the parrot. And they tend to have much heavier body for their size. They tend to have very different weight-bearing mechanics than a parrot does. So it's much more crippling to them if they lose the use of a foot. Especially with the chicken, they're not always the greatest flyers, so they need their feet to be able to get from point A to point B. With a bird such as a raptor, those feet are not only involved in holding onto a perch, but that's how they catch dinner. If they don't have functional feet, they can't eat. Songbirds tend to handle the loss of a foot relatively well because they are so light-bodied. It basically is used for perching and holding on to things, but they're not catching food with it. They're not necessarily scaling a tree with it, so they can handle it a lot easier. So this chart is kind of a very small summary of all the different types of feet that we see in birds, and they're adapted for multiple purposes. On the bottom right here, we have our parrot foot, which is adapted for climbing and clinging. So not only holding on to perches, but climbing up the side of a cage, climbing up the side of a tree, holding on to a foot, to a food item or other structure. These feet are made for grabbing. You've got 2 toes facing back, 2 toes facing front. So it's a really good setup for holding on to things. Up at the top, we have an example of a raptor and an osprey. These guys are also meant for holding on to things. They've got more of a 3-in-1 setup. 3 toes face forward and 1 toe faces the back. They've also got major claws. That rear-facing toe has a special name, the hallux. Basically, if you don't have that hallux, you cannot catch food. Moving on to your perching birds like the sparrows, these guys just need to hold on to a perch. So they've got a very simple grasping type of foot. The top left here, we have an ostrich. These guys, they're not perchers. They don't need to grab things. They just need to run real fast and stand up. So they've actually consolidated their toes into just 2 toes. Their adaptations are basically for propulsion and nothing else. In the middle here on the lily pad illustration, we've got a example of a wading bird, and likewise down here, our heron. The wading birds tend to have very long toes. You can think of it almost like a tripod. They're not really grabbing onto perches and things. They just need to stand upright in unstable footing surfaces like the muck at the bottom of a pond or a rocky shore. They just need to be able to stand upright. So they've got almost like a tripod setup so that 1 toe can be higher, 1 toe can be stuck in the muck down here, and they stay upright. Off to the middle left here, we've got all sorts of adaptations for swimming. We've got the duck and the cormorant, whose foot has basically been turned into a giant paddle. Whereas some of your other swimming birds, like the avocet here, it's kind of a half paddle. And your coots and grebes almost have little foot paddles instead of whole foot paddles. So all sorts of adaptations. And this is how the problems with the feet can affect the bird very differently depending on who they are. If a duck loses the middle toe, he loses the ability to paddle through a pond. Whereas if a parrot loses 1 toe, no big deal. They can still hold on to a perch. So on the left-hand side, we've got an example of basic parrot anatomy. And on the right-hand side here, I cannot remember exactly what I downloaded. Can't remember what type of bird that is, but we can see how the part over here from the knee down to the tips of the foot, this is what we see of a bird's leg. And the part we're interested in here is just this last little bit here. The exact anatomy of the foot even differs all the way up to the level of the hock joint. The parrot has a very short little bone here because they need a lot of mobility of their foot. Whereas this guy looks like he's more of either a hawk or a perching bird. They tend to have a longer bone here. They don't really need that kind of rotational mobility that a parrot does. So even in the parrot family, these feet are evolved for multiple different purposes. Up on the left, we've got the Amazon parrot that's using their foot as a feeding device. We're holding the nut. We hold it. We twist our foot to bring it to our beak. We twist our foot to put it back down again. They're built for walking. This little guy, this little macaw here, busy cruising across the ground here. Our little lovebird on the bottom left is not only holding on, but holding onto a vertical surface. So they need very grippy feet. Those feet are even adapted for tool usage, as shown by this Amazon on the bottom right that's busy scratching his head with his own feather. So, a little bit on perching mechanics of a bird. We've got 2 illustrations here that show how the foot grabs onto a perch. You'll notice how on the top one especially, a lot of the bird's weight is focused right here in the center of the foot. The actual force of the foot sits just ahead of the very middle of the perch, but most of the weight is borne right on the center here, the center of the foot and the very near parts of the toes. This will come in important down a few slides later, but bear in mind how exactly we hold onto the perch and how the weight settles onto their feet. Also notice the difference between the 2 illustrated perches here. The perch on the top has a relatively narrow perch in relation to foot size, while this illustration on the bottom with the parrot, the size of the perch is comparatively larger when compared to the foot that's perching on it. So one last little anatomy lesson here. How do we look? When folks call us to tell us their bird is having a problem, often there's some confusion about, which foot are we talking about? People tend to label the feet based on how they're looking at the bird. So when we're looking at the bird, we identify left and right based on the bird's left and right, not our left and right. So if we're staring straight at the bird, like in this picture, their left is going to be the same as another person's left. Their right is going to be the same as another person's right. The toes are labeled from basically from rear closest to the bird, moving around to rear facing away from the bird. So in people, we give our digits names like our index finger, middle finger, ring finger, etc. In birds, they just get numbered 1, 2, 3, and 4. In parrots, digit 1 is the one that is closest to the middle of the bird, facing backwards. Digit 2, closest to the bird, facing forwards. Digit 3 is away from the bird, facing forwards. Digit 4 is away from the bird, facing backwards. You can basically take these numbers and mirror them to label everything on the right foot. So 1, 2, 3, 4. So the most common types of foot problems we see in birds, number 1 is definitely bumblefoot or pododermatitis. We see leg band injuries fairly frequently, bite wounds to the feet, and toy entrapments. So with bumblefoot, the fancy term that we'll use is pododermatitis, which translates to inflammation of the skin of the foot, and is by far and large the most common problem we see of the feet of birds. It affects all species, parrots, poultry, waterfowl, even birds of prey, especially those kept in captivity. Even zoo animals have problems with bumblefoot. For example, flamingos. It is a major problem in captive flamingos. There's a lot of factors that go into why this develops in our parrots and other birds. Age is a big one. Middle-aged and older birds, just like middle-aged and elder people, are not always as active as they used to be in their youth. They're more likely to have other health problems, arthritis, so they tend to be more prone to foot problems. The weight of the bird also plays a major role. Heavy birds means a lot more weight borne on their feet, which is more wear and tear on the feet. Birds with pre-existing orthopedic problems like injuries, a broken leg that didn't heal 100% correctly, older birds with arthritis, anything that changes how you use your leg is going to change how you bear weight on your feet, and that will potentially lead to bumblefoot. Birds that are inactive, even youngsters that have no pre-existing health problems and they're of a good body weight, if they're little perch potatoes all day, they're basically standing on those feet without moving very much for long periods of time. And just like we see in, say, chefs and auto mechanics, if you're standing around in the same place all the time with little movement, your feet start to bother you too. Birds that are not taking in enough vitamin A are more prone to pododermatitis. Vitamin A is necessary for all of your epithelial cells, as they're called. Epithelial cells are basically the cells that cover you and line you, and this includes your skin. If you're not taking in enough vitamin A, your skin is not healthy, and that's skin that is more easily going to become diseased, such as bumblefoot. Perch materials and size play a role. If, say, we've got a macaw trying to hold on to the teeniest little stick of a perch, he's going to have more problems with his feet as opposed to a big perch that he doesn't have to grab onto so tightly. Perch materials such as, say, sandpaper perches or smooth wooden perches sometimes can also lead to some problems. Perch hygiene is also important. I trust that all of us here are scrubbing our perches regularly and keeping them clean, but birds who live in dirty environments where there's a lot of poop and such caked onto the perches, they naturally are going to be more prone to foot problems. We grade bumblefoot on a number scale, and we grade it from least to most severe. There are multiple grading scales, as you can see on the right here. The one on top is used by a wildlife center, and they use it in reference to birds of prey, little songbirds, and theirs is a 7-point scale. On the bottom, we've got a 5-point scale that's used in chickens. In general, the higher the number, the worse the disease. So here we have a picture of a nice normal parrot feet. This is what I wish everybody's feet looked like. You can see how we've got a nice cobblestone appearance to the bottom of the foot. We don't see any dry flakes or the like. The skin around and underneath the leg band looks nice and normal. Even here at the hock joint, we still have that cobblestone appearance and a nice, clean, happy foot. Mild bumblefoot, what we would call a grade 1. On this little bird, we can see how the feet have a very dry looking appearance. We've got kind of white gray skin flake buildup around all those cobblestones on the feet. This left foot here with the arrow, this area right here, you've kind of lost that cobblestone appearance. It's worn very smooth. This is the earliest stage of bumblefoot, and this is where I see a lot of my parrot patients. This next slide, we've got mild to moderate bumblefoot. On this cockatiel here on the left, you can see how that wornly smooth area is starting to look more pink than it should, especially compared to the rest of the foot. This Amazon here in the middle, we can pick up some swelling of this digit as well as smoothly worn skin. We're starting to get that redness and even just the hint of a little scab right there on that toe. This budgie on the right has a similar appearance, very swollen at the base of the toe. You can make out a little scab. Similarly, on its left foot, you can see a similar change on the same toe on the opposite foot. These are some examples of some severe bumblefoot. On the left, we have a hawk. You can see this massive scab dead center in the foot and another one off on this digit here. I can tell you from experience, this scab actually probably extends deep into the foot. It's not just a superficial scab. It probably goes a good couple millimeters or more into the foot. This poor chicken on the right, this is a pretty severe case of bumblefoot, where we've basically got a massive abscess making up the bottom of this foot. And I can practically guarantee you that this thing is starting to infect or destroy the bone right next to it. So what do we do when we have a bird with bumblefoot? Getting some radiographs or x-rays is very important. We need to know what the bone underneath those lesions is doing. With severe bumblefoot, as you can imagine from that chicken, the deeper it goes, the closer it gets to bone, and the more likely we are to have bone infection. So those x-rays help us stage it out and determine how aggressively we need to treat that bird. It helps us choose our antibiotic selection. If we know, for example, we have a bone infection, we need to pick antibiotics that get into the bone really deeply. Duration of antibiotics. If we have a bone involvement, that tends to take much longer duration of antibiotic usage. Whereas if it's just the soft tissues overlying the bone, we may not need antibiotics quite as long. If we see really deep lesions that affect bone, we may have to plan surgery, for example, as opposed to chest medication. The worse the state of the bones, the worse the prognosis. Naturally, the less the bones are affected, the better chance we have at producing good results for that bird. The more damage the bones take, that bird may not be normal again, and we have seen similar cases where the bone is practically eaten away by infection, and you can imagine those toes are not going to be salvageable. In some cases, we'll get a bacterial culture of the lesions, especially like that hawk and the chicken. Those are ones we definitely want to culture. We want to know what antibiotics are going to be best to use against it. Many times with skin infections, we'll see staph bacteria involved, but sometimes with, say, a hawk, you may have random fecal organisms in there or meat-based organisms in there. We even see things like MRSA popping up in some of these bumblefoot birds, so we need to know the best antibiotic to use for them. Now, basic blood work, like we often run for just general health screening, does not necessarily tell us much when it comes to bumblefoot. It may give us an idea of how bad the inflammatory response or infection is based on how high their white blood cell count is. But in many cases, where it helps us the most is birds that look like they're going to need to be on long-term pain medication. Knowing the status of that bird's kidneys and liver gives us a better idea of what drugs we can safely use for this bird for the long haul. In larger birds, say like a chicken or a hawk or, heaven forbid, the ostrich, ultrasound can be used to check out the tendons and ligaments running along the bottom of that foot. If we see tendon and ligament damage, that's a bird that may not have as good an outcome. Now, unfortunately, in birds like a budgie, for example, ultrasound is going to be no help to us. Their feet are just so tiny and small that the ultrasound can't really distinguish between the different structures of the foot. So, what do we do with these birds? In milder cases, which thankfully makes up the vast majority of what we see in our parrot friends, it's a matter of perch management and overall health management. So with perch management, we're talking about perch variety. If you imagine a pair of shoes, if I were to wear, say, my hospital clogs all the day, every day to everything I do, my feet are not going to be terribly thrilled with me. They're going to be very disappointed in me when I go for my afternoon run. They're not going to be thrilled when it's wet outside, And even just standing in those things for weeks straight, my feet are not happy. So having a variety of perches is kind of like having a variety of shoes. Today I will wear my sneakers. Tomorrow I will wear my clogs. Saturday I'll wear my hiking boots, and I'll throw on my sandals when I'm done. That tends to keep our feet happy, and similarly, perch variety keeps our parrot's feet happy. So we're talking, have a rope perch, have a concrete perch, have some natural branch perches, have a variety so they have lots of options of what to stand on. We also need to make sure the bird is using their variety of perches. You've probably noticed that your bird has a few favorite spots in the cage that they like to hang out on. They don't care what perch is there. They're going to stay right there because that's where they feel most secure. Um, it could be the worst perch in the world in that location. They will stay there. So every few weeks, it helps to move your perches around so that if your bird, say, chooses to stand in the upper left corner of the cage, for 2 weeks, we're going to have the rope perch. Then the next 3 weeks, we're going to have a natural branch in that location. Then we'll move the concrete perch in there for a couple weeks. Then we'll rotate back to the rope perch just to make sure our bird is using the different varieties of perches. Perch hygiene is important. I trust all of you are taking good care of your perches, but just make sure that we're scrubbing them down routinely. You don't necessarily have to, bleach them and sanitize them per se, but just keep them clean. Weight management is going to be important. Heavier birds are more prone to bumblefoot, so keeping our birds at a healthy body weight will help to protect their feet. Dietary management comes into play not only for weight management, but making sure they're getting enough vitamin A intake to keep the skin of their feet happy. With dietary management, we may also be talking about joint supplements, glucosamine and chondroitin, much like we use in humans. Say you've got an elder bird, getting them started on a joint supplement even before you notice signs of arthritis can go a long way towards keeping those joints and legs happy, which translates to happier feet down the road. For more severe cases, we may be talking about pain management. If we've got an arthritic bird, we've got a bird with really gnarly lesions on their foot, we definitely need to take care of them with some comfort. Your bird might need antibiotics, whether it be systemic antibiotics taken by mouth. It may be a minimal enough problem that we can do it with topical antibiotics, little creams and ointments to put on the foot. In more severe cases, we can actually do local infusions where the antibiotics are injected into the tissues, basically giving localized penetrating antibiotic treatment without having to go the systemic route. The feet may need to be bandaged. On the right here, we've got a couple of examples of how feet may be bandaged. A here is just kind of a soft padded bandage. There's some cotton bandage material underneath this blue vet wrap, and we're just looking to cushion the feet with that. It's also holding the foot in an outstretched position to spread the weight over more of the foot, so it's not concentrated in the center of the foot. Picture B here, we've got this fun little donut cutout. Where these come in handy is if you've got, say, like that hawk we saw several slides ago with the giant scab in the middle of its foot. A bandage like this takes pressure off the center of the foot, much like a corn cushion does. So it distributes the weight off of the affected area, which allows it to heal without having a bunch of pressure and wear and tear on it. In the worst cases, such as that hawk and certainly that chicken, surgery may be needed to go in, clean out all and remove all the diseased tissue and get back down to healthier tissue. In some cases, this may be followed by bandaging. In some cases, we're lucky enough to be able to suture it closed again. Some birds may need multiple surgeries to get their bumblefoot under control. The prognosis for bumblefoot, how these guys do over the long haul. The milder cases, as long as we make those husbandry changes and keep close watch on their feet, they're going to do really well. Some older birds may have ongoing problems with their feet, and this just is part and parcel of being an older bird with arthritis and such. But even with appropriate management, we can keep those guys relatively comfortable and keep their lesions mild. The more severe the lesions, of course, the worse the prognosis. Some of the moderate cases may need long-term pain management, such as your elderly birds. They may need perch modifications to keep their feet happy. The severe cases, especially that chicken we saw, they may not do so hot. These are birds that may have ongoing lameness and orthopedic pain no matter what we do, especially if the bones of the foot are involved. They may not heal correctly. They may always walk with a limp or a hitch. Some of these birds may need repeated surgical intervention to clean all the dead tissue and infected tissue out of their feet. If bones, ligaments, or tendons are damaged, they may lose the foot entire foot itself. The tendons on the leg that handle closing the foot, those tendons run along the bottom of the foot, which is where we see all the bumblefoot lesions happen. If it goes deep enough, a tendon can actually rupture. And tendons are not structures that like to heal particularly well. When you look at, say, athletes that rupture their Achilles tendon, they're usually out for a year after their surgery while that tendon heals up. It's not an easy injury to bounce back from. If a bird loses the tendon, there's a good chance they're not going to be able to use that foot correctly for the remainder of their days. If that foot is not normal for the future, they're going to tend to overuse the quote unquote good foot, sparing their not so great foot. And that's going to set the good foot up for developing bumblefoot down the road. And then we have a bird with two crappy feet. Heavier bodied birds like your macaws and your larger cockatoos and such, and poultry tend to fare worse just because they're bearing so much more weight on their feet than, say, a tiny cockatiel or a budgie. Some of these guys are bad enough that the kindest thing we can offer them is sadly euthanasia. If their bones are just completely destroyed by infection, if their tendons are ruptured, they may not be able to have a good quality of life no matter what we do. So leg band injuries are something we bump into periodically. And what happens with these is that the leg band becomes too tight on the leg, whether it be built up skin flakes that don't come off as they should and that get stuck under the band. I've seen birds that have damaged bands where, say, the band got chewed on by a large macaw and got bent or twisted in some fashion. Some birds, the band ends up being too small. Leg bands are generally put on the bird when they are wee little babies and they basically grow into it. We make assumptions on what size band the bird is going to need, like, cockatiel needs size X band. Well, this guy might be bigger than the average cockatiel, and the band ends up being too tight once he's fully grown. What this does to the bird is you end up with a constriction injury. The band is so snug that it starts to cut off blood supply to the foot. The foot, in response, starts to swell because it's not getting normal drainage of blood and lymphatic fluid from the foot. So the foot starts to swell, which makes the band even tighter, which makes the foot swell more, which makes the band even tighter, and it just snowballs on itself. As the band gets tighter and tighter, it starts to cut into the tissues and starts constricting everything and strangulating the tissues. If left unattended, this can actually lead to complete loss of blood supply and nerve supply to the foot, and this causes death of the tissue and loss of the foot. So here's an example. On the right here, we can see we've got the cut leg band that has been removed from the foot. Underneath of it, these are the gross skin flakes that built up underneath that band. And they, along with the band, were starting to get so thick that they cut into the foot. And you can see how we've got this cylindrical area in the middle of this bird's leg that is just squashed in compared to the rest of the leg. This bird, given the odds, is going to have a perfectly good leg within about a week or so. This type tends to heal up really quickly and nicely. A more extreme example is this poor little galah cockatoo here. It's got the old school import band from the early 90s and before. You can see how tightly this is cut into the foot here. And just below it, the foot is not only swollen, but this darker section of skin, this is skin that's lost blood supply. It is going to fall off given some time. On the right, we can see what this bird's foot looks like once the band has been removed. You can see the indentation right next to that scabbed area of the foot. This thing was cutting in pretty tightly. And below that, we have all sorts of swelling of this leg and swelling just above it as well. This bird probably is going to do okay. I'll bet this part sloughed off eventually, but within a few days to a week, this leg was probably looking pretty good. In the most severe cases, we have this poor cockatiel. You can see how deeply this leg band has cut into the foot. There is like multiple millimeter constriction right here. This leg band, unfortunately, cut in so deeply that when they went to take off the leg band, the whole foot came with it. Notice the color change on the left. We can just see a little smidgen of the normal unfeathered skin here on this part of the leg. On the other side of the leg band, everything is black. That is dead tissue. And this is the worst possible case scenario with a leg band injury. We lose the entire blood supply and nerve supply to the foot, leading to death of the foot. So what do we do with these? First and foremost, before anything else, we have got to get that band off. That band is going to continue to cause problems until we can get that thing off of there and relieve the constriction. I've got pictures here on the top of a standard band cutter, which will work for most leg bands on, say, a cockatiel or some of the smaller conures. For your old school import bands or some of the bands on, say, a macaw, you need double action bolt cutters to get those things off. Those things, even though they're made of aluminum, they're really sturdy. Because of how the equipment we need to use to remove that band, the fact that it's so tight to the leg, and the bird is probably freaking out and in pain, many of these guys will need some sedation, if not full anesthesia, in order to cut that leg band off safely. Going back a couple slides, if you can imagine what happens, this bird has one of the import bands that takes a double action bolt cutters. If you can imagine a kicking, screaming cockatoo kicking that leg as I'm trying to cut off this really tight leg band with a pair of double action bolt cutters, you can imagine the risk of disaster if that bird kicks at the wrong time. So this is a bird I would totally have anesthetized for their leg band removal so we can have some margin of safety of removing it. These things can, and in some cases do, hurt legs when we try to remove them. This is even true of a bird without a constricted leg band. Because we have to use such heavy-duty equipment to remove leg bands, even in healthy birds, there is some risk of injury. In the best-case scenario, it might just be a little cut to the skin. The worst-case scenario, I have seen birds end up with a broken leg because of the heavy-duty band cutters. Now, granted, these birds often, say, had bone problems to begin with because they're eating seed diets and taking in no calcium, but still, it's a risk. But despite these risks of injury to the bird, we have no choice. We've got to get this leg band off to have hope of recovery. Some of these birds may need wound bandaging and care for a few days after the band comes off. When those nasty skin layers and such and the band come off, we can have bleeding wounds that need to be addressed. These birds often need some pain management. They may or may not need antibiotics. That guy probably does not need antibiotics or any bandaging. He probably just needs a few days worth of meloxicam. This fellow will probably need some antibiotics as well as a few days of meloxicam. This guy's looking at a lot of antibiotics, some bandaging, and possibly other wound care for a good week or so. The prognosis, for the most part, is surprisingly good. Even really gnarly deep defects can fill in within about a week as long as you take care of them. However, like that cockatiel on the last slide, there's no resurrecting a dead foot. Once the tissue is dead, it's gone. It's not coming back. Severe cases like that cockatiel can lose toes, or worse, we can lose the entire foot. So with bite wounds, the most common scenario we see is big parrot, little parrot. Small parrot that thinks it is approximately the size of an eagle goes forth and annoys the larger bird. The larger bird gets annoyed and bites the small bird. Small bird ends up with a major foot injury. We've seen lacerations where the beak just cuts into the tissue and rips it down to the bone. We can see crush injuries where the force of that beak breaks bones within the foot. We have seen traumatic amputations of toes. One of my clients, when I was doing my residency, had a budgie that just loved to go perch on her tin McGray's cage. The gray did not think much of this, and after the third time I was called in at night on emergency because the budgie had literally had a toe bitten off, I asked her to please, for the love of all that is holy, please stop letting the budgie visit the gray because we're running out of toes. The full extent of the injury may not be readily apparent. Sometimes the damage to the nerve or blood supply of that toe is not immediately apparent. We may have a toe that looks, kind of like this little galah here on the left that initially looks normal. Over the course of the next few days, the toe just gets darker and darker and more shriveled looking. Disruption of blood supply is one thing that may not show up for a couple of days. This little cockatiel here, you can see we're actually missing a healthy chunk of that toe. And here we have a eclectus ready to bite the snot out of the first budgie that lands on his cage. So what do? First thing first, stop the bleeding. If you're stuck at home and can't get to a veterinarian quickly, you can use a little styptic powder, just tap it onto the wound if the bird will let you. In a pinch, cornstarch, ordinary kitchen cornstarch will work. It may be enough of a wound that we need to suture it closed. The bird may need a foot bandage to protect the tissues and keep him from overusing the foot while it heals. We may need antibiotics depending on how badly our foot got wrecked, and certainly some pain management. It's important to remember that the extent of tissue damage and wounds may take a few days or more to show, and we may not know for a week or so if we're going to lose a toe. Some of these birds will need multiple bandage changes over the course of a week or two until we can see exactly what tissue we're going to keep and exactly what tissue is going to be lost. We may need to, say, plan a surgical removal of damaged tissue a week after the original injury happened. With toy and perch entrapment, basically it is what it sounds like. The toe gets stuck in a toy. Common offenders include bells, with this little bell right here, where little loop at the top is a good place to stick a toe. The clapper of the bell on the inside often has a similar attachment, a little loop that the clapper fits into, and that is a perfect thing to get toes stuck into. Toys with chains, like this one the gray is playing with, toes get stuck in chains. Strings and other things, for example, rope perches. If the bird shreds the rope perch, it's going to have strings sticking out everywhere, and those strings can get twisted around a toe. The happy hut here that our little conure friend is in, those are notorious for getting strings as the bird shreds them, and those can get stuck around toes as well. It has a similar effect to what the leg band injury will do. Either the string or the hole in the bell will get stuck and start to constrict the toe, leading to a similar type of strangulation injury. We can have lacerations as the material cuts into the toe. And with these kind of injuries, we also have to bear in mind secondary injuries that happen. A bird that gets stuck like that is probably going to be flipping out. They're going to be flapping their wings, panicking, pulling, trying desperately to free themselves. And those kind of jerking motions as they pull their leg, as they try to fly away, can cause dislocations of bones within the foot or the leg, or even broken bones as they frantically try to free themselves. As an aside, we see similar kinds of injuries in birds that are on flight leashes that attach to a ring on their leg. If they take off and pull on the leash, suddenly they can break a leg. Similar injuries are seen in falconry birds that do what's called baiting. The falconry birds wear these little bracelets on their legs that are often threaded into little leash-like apparatuses. If the bird takes off from its perch without the falconer being ready, the bird reaches the end of the leash suddenly and snap, breaks a leg. So what do we do with these? We approach them much like we do with bite wounds and band injuries. The basic idea of what happens is similar. So if we've got a laceration, we suture it closed. We get the stuck toy, the constriction, off as quickly as possible. This may involve magnification and scissors if there's strings involved. We may have to bust out the bolt cutters if, say, we're stuck in the middle of a bell, or pliers, or anything to pry that item off the bird's foot. Depending on what sort of wounds we see, we may need wound care, whether it be suturing or bandaging. It may be a matter of just pain management, possibly some antibiotics, depending on the extent of the injury. Much like with bite wounds, the full extent of the injury may not be apparent for a few days, depending on how badly that toe was stuck and for how long. And we may need to address injuries from the bird's attempt to free itself. The foot itself may be minimally damaged, but we may have, say, a broken leg to address, like in this bird here on the bottom right. So with foot health, prevention goes a long, long way. So part of this is appropriate perches. Big birds need big perches. If we ask our macaw to stand on something that would be more appropriate for an Amazon, that macaw is going to have very unhappy feet before long. Perch variety is very important. So sizes of perches, textures of perches, materials they're made of. For example, this natural branch perch right here is a great example of perch variety. We've got thin parts, we've got thicker parts, we've got knobby parts, we've got changes in direction. This is a lovely perch because it gives our feet so many options of what to grab onto. The rope perches, they have a softer texture, so they're a nice soft option to stand on. They're nubby, so there's some texture to them. They tend to be easy to hold on to because of their texture and the strings. The birds on the bottom here, this little Senegal on the bottom right, he's got a natural branch perch that's been sawed in half. So you could flip this perch over, and you could have the nubby natural bark side of it. you could flip it as it is, and he'll have a kind of a platform to stand on. It's important for us to encourage variety, but also keep those perches clean. Scrub those perches periodically. With rope perches, you may have to toss them and replace them periodically because it's sometimes impossible to get all the poop out of those things. Any damaged perches need to be replaced or addressed ASAP. So with our rope perches, if you see strings hanging off them, cut them or replace the perch with a brand new one. If our bird has chewed that wooden perch to where splinters are starting to pop up, time to either sand that perch or replace it with a new perch. We also need to adjust perches based on our need. Now, if we remember back to earlier in the slideshow here where we showed perching mechanics, we had the foot grabbing onto a smaller perch on the top and a larger perch on the bottom. Perch sizes and textures may need to be adjusted based on the needs of the bird. So say we've got an arthritic old bird, holding on to a small perch when you have arthritis is difficult. You've got to really squeeze on tightly to a narrow perch, and that can cause a lot of discomfort. So an arthritic bird may need like a large perch. It may be that your mid-sized cockatoo now lives on macaw-sized perches. They're huge compared to the bird, but you don't have to hold on to them very tightly, which makes it easier for that bird to stay on the perch. With the top, let me see if I can bring up that earlier slide here. Where'd you go? Here we are. So with a bird that has bumblefoot or is having trouble with their perching, notice how the smaller perch also concentrates a lot of the weight bearing right in the dead center of that perch. Whereas this larger perch versus foot size on the bottom here, the weight is distributed over more of the foot instead of focusing right there on the middle. And that's where some of the larger perches and flat perches come in handy. Instead of having to bear weight mostly on the center of our foot, the larger perch or flat foot perch distributes that weight over the toes. So the center of your foot isn't taking all the wear and tear. It's also very easy to hold on to that large perch. And with a flat perch, bird doesn't even need to hold on. They just need to stand, which can be lovely for some of the older birds that don't perch so well. There we go. So our little cockatiel friend here has a lovely even set of stairs leading up to this very flat perch. There's no perching involved in here. We don't have to grab a thing. We can just stand right there. It's hard to fall off of a perch like that. So this makes a very nice option for older birds that have issues with perching, that have issues with bumblefoot. Now, this perch right here that the cockatiel is standing on, it doesn't have to be some fancy bird perch per se. They sell similar platforms like this in the small mammal section of the pet store. They're geared towards chinchillas. It doesn't matter if that platform is made for a chinchilla or a parrot. It works. Pick the one that costs less. It may be that softer materials are needed. So it may be that we replace some of the harder wood perches with rope perches for the future. It may be that we cover that wooden perch with vet wrap or similar self-adhesive bandaging material to give it some softness and give it some grippiness. Weight management is very important to managing foot health. The lighter on your feet you are, that's less wear and tear on your feet. Obese birds are far more likely to develop problems with their feet, so keeping your bird slim and trim will, in the long term, work to protect their feet. This boils down to limiting seeds and nuts, keeping the fruits to a reasonable level, avoiding sweet treats and starchy treats, and likewise encouraging exercise. The more a bird gets up and moves, the happier the feet and the more trim the bird. With those dietary management factors also comes vitamin A intake. The healthier our bird eats, not only does it help their weight, but it gives them appropriate vitamin A levels, which leads to healthy skin, which means happy feet. Great sources of vitamin A include dark leafy greens and pelleted diets. Now, pelleted diets are easy enough. Whether you do Zupreme or Harrison's does not matter. Both of them are great sources. Dark leafy greens can be a bit of a hard sell with our parrot friends. Sometimes if you use a binder clip to clip the greens to the side of the cage, it looks like a houseplant, and who doesn't like destroying a houseplant? Any of the vegetables that are orange, yellow, and red tend to be great sources of vitamin A. So that includes your bell peppers, sweet potato, carrots, that sort of thing. Keeping a eye on your bird's leg band is going to be important. Regular bathing will help to keep the skin flakes down and keep the skin nice and moisturized. Making sure the bird has adequate vitamin A intake will help the skin cells to flake off naturally instead of building up under the leg band. And periodically inspecting your bird's leg band. Is it appropriate shape or does it look like it's been bent? Are we getting skin flakes built up underneath? Is my bird getting calluses associated with it? Is my bird picking at the band a lot? These can all be signs that the leg band may need attention. Now, some folks elect to just remove the leg band entirely. We have to weigh the risks versus the benefits with that. Risks, as I mentioned in earlier slides, includes injury from removing the leg band. If the bird kicks at the wrong time, we could have a cut or a break from the band cutting material itself. Benefits of keeping the leg band is identification. While there's not a national database per se where you could look up your bird's leg band numbers and register them, hey, bird wearing XYZ123 leg band, that belongs to me and his name is Sunny. But it's still unique to your bird. If you are doing international travel with your bird, you need to have some sort of identification on it. So keeping that leg band can be handy. That said, if you are not planning to move your bird to France and you don't really want the thing there, easy enough to remove. It is legally not required for your bird to wear a leg band. It's only required at the breeding facility. Once they leave the breeding facility, you can remove that band if you wish to. Keeping your bird active and moving will be wonderful for foot health. The more we get up and move around, the happier our feet are, and the more your bird is up and moving, the happier feet theirs are. So encouraging them to use a play gym, fly around the house, walk around the house, climb their cage. Just keeping those feet active will help to protect the feet. It also helps with your bird's overall fitness and body weight. Some birds may need medical management, whether it be starting them on a glucosamine and chondroitin joint supplement. An easy way to do that, if you're familiar with the good old NutriBerries, they have the Senior Bird NutriBerry now. The Senior Bird NutriBerry has glucosamine and chondroitin built right into it. So instead of taking a zester to a human glucosamine tablet and trying to scrape off a few flakes in your bird's food bowl, you just give them the NutriBerry. Now, the amount they suggest on the package per bird per day is assuming that the bird is only eating NutriBerries and nothing else. It'll tell you to feed your Amazon like 8 to 10 NutriBerries a day, which is a lot. If you're just using this as a supplement, you could probably do, 1 or 2, maybe 3 of these a day, depending on the size of your bird. Some birds may need to be on long-term pain management, such as meloxicam or gabapentin, say if we've got an arthritic bird or a bird with bumblefoot lesions that we anticipate may not be something we can clear up immediately or at all. So that, in a nutshell, is bird foot health. Okay, let's see.
Yeah, there are a couple of comments and questions in the chat, and then we'll open it up.
Okay. Okay, and stop sharing. Yay, I've got that back now. Okay, let's bring up the chat there. Okay.
Candy talked about owner's hair. I know that's a common cause of toe entrapment. The
Yes.
birds are in your hair and twist around their feet.
Absolutely, yeah. So especially if you've got long hair, that can wrap around a toe very easily. If some folks, when that happens, they'll notice like a sudden narrowing in the bird's foot that the bird's trying to pick at. It can take magnification to find those hairs and get them off safely. But absolutely, owner's hair can be a big one.
Yeah, the thing with my hair is it's sort of a gray blonde, and an individual hair is literally invisible.
Yep.
And my African gray, I happened to notice as I put him away that there was an indentation in his foot. And if I hadn't seen that, he was
Yep.
going to bed for the night. So we used a suture removal scissor with a little curve on the end to get under the hair. My husband had to help me, and he hates touching the birds, but he helped me. It was quite a process.
Yeah.
Little hair. I can't believe how tight that was on his foot.
It's amazing how deep those can cut into a toe, but the good news is often once you get the hair out of there, they heal up within a couple days.
And it was quick. I mean, I noticed it as soon as I put him away, but one single blonde or gray hair is totally invisible.
Yep.
I couldn't figure out why is his foot so, and then I saw the hair hanging down. I was like, oh no. Sorry, I just thought I would bring that up because wow.
It's an excellent point. Yeah, human hair is definitely a risk.
Okay.
The same reason, it's a lot of folks that love feeding their bird or their wildlife birds and giving their songbirds nesting materials. Things like yarn and yarn scraps, or you do not want to offer that to your yard birds for building nests with, because the yarn fibers can be entangled on toes really easily, especially with baby birds.
Okay, so Bree asks, where can I purchase bird-sized bolt cutters to remove small, medium, large, etc., chain links and other toy items? Bree, do you mean that if your bird isn't trapped at your house so that you can try to remove it? Or if you want to unmute yourself, Bree, you could go ahead and ask.
Yes, that would be very accurate. Because that way, I'm in Valencia, so I'm pretty far from any place I could get my little guy, checked at. So that would be helpful.
Yeah, with cutting say chain links and such, there's not a specific bird size one. You just it'd be like a double action bolt cutters or some bolt cutting pliers, which you could find at the hardware store. If you're in that kind of situation, it's probably safe as a chain link to cut a few links away from the bird to at least get the bird free enough, and then get them to the vet to get the up close and personal cutting of the link off the bird's toe, because that's something where it is way too easy to cause worse damage trying to peel that thing off a toe. But if at least you can free them enough to get them out of immediate danger, that's good enough. I'll take it from there.
Okay.
Gotcha. But if for some reason I wasn't able to get to you guys, and it's like 2 a.m, and for sometimes I have a car, sometimes I don't. I'm very good with my parrots. I'm able to wrap them and towel them. I helped actually with the necropsy of one of my parrots, and so I'm very skilled at this kind of thing. So that's why I wanted to know, just in case, because that
If anything
just
at home,
what's that?
as if anything at home, what might be a safer option would be to, get a little ice pack on that toe to reduce the swelling, and maybe like some olive oil or some soaps, just something slippery to lube that toe up. And it may be some ice to shrink the toe and lubrication. You might be able to slip off that chain link without having to risk cutting it. My big fear with trying to cut it directly off the toe would be if that bird kicks, you could actually cut off the toe.
Right. No, exactly. No, thank you very much. I just didn't know if there was anything you vets guys use that have that size, because I have bolt cutters, but they're for big old locks and
And honestly, it's
chains.
Yeah, that's what we've got. Is we've got a couple set of bird band cutters, which I think I've seen on Amazon, and then literally double action bolt cutters from Home Depot. That's what we've got.
Fantastic. Thank you so much. I appreciate that.
Oh, my pleasure.
Okay, Gayla says
Thank you so much.
Oh, go ahead. Gayla says my vet removed my parrot's leg band. Susie says, is toe number 1 equivalent to our thumb? So would it be a helix?
Yes, and the helix specifically refers to the birds that have the 3 up front, 1 toe back formation. The toe that's facing back is digit number 1, and that is indeed the helix. Digit number 1 is indeed analogous to our thumb. They just stop at number 4. They don't have an equivalent of the pinky.
Okay, Bethany says, thank you for a fantastic presentation, Dr. Sinclair. My fellow Sharon Audubon Center colleague and I are on, both of us having companion birds in addition to our center's raptors. Excellent information. Thanks again.
Okay.
Excellent. Okay, Diane says, is there an ointment we should have at home to put on an abrasion or bite?
Good old triple antibiotic should be fine. I would aim for the plain version. There are some versions out there that have like lidocaine or other pain medications in there. I would stick to the regular plain stuff. It's hard to dose out lidocaine accurately when it comes in an ointment form like that. And heaven forbid the bird try to lick it or ingest the ointment. If they ingest the lidocaine, that could be harmful.
Right.
So I would just do like a light, thin layer of Neosporin. You don't need to goop it on there. Just make the wound shiny.
Right. Heidi says, how often do you recommend nail trims for birds?
Very individual question. It depends on that bird and how quickly their toenails grow. It could be monthly, it could be twice a year. It really depends on your bird, how quickly their toenails grow and how quickly they wear them.
Right. Rosemary says, once a parrot has bumblefoot, would their foot ever look normal again?
That depends on how severe it is. Fortunately, a lot of the birds we see fall into the mild and moderate category. And with those birds, often we can get normal feed again as long as we pay close attention and take the appropriate corrective measures. It's the guys that have the most severe bumblefoot that don't tend to have normal feed again. Just going back to that poor chicken, that guy's probably going to be lame for life, and that foot may never completely recover from it. But many of the birds I see, we're just at the stage where the bottom of the foot's getting a little smooth and maybe a little pink. We can have good luck with those.
Yeah, I knew a cockatiel online that it was so severe he ended up with an amputation. So, okay, Gayla says, other than nutriberries, how can I give my parrot glucosamine supplement?
Well, at the moment, the nutriberries are the only bird-specific option I'm aware of. Some of the
Nutriberries.
Yes, there's some bird supplement companies you can find on Amazon and various other websites that might advertise a glucosamine supplement. With any supplements, whether it is for humans or for birds, they are completely unregulated by the FDA. So there's no government oversight, no testing or anything. It's very much buyer beware. At least with Nutriberries, it's a veterinarian-owned company. They do a lot of research and development and testing, so at least that you can trust. If you were to go outside of that, you could take a human tablet and like a zester or a file and just grate some into their food. It tends to sprinkle on top of the food, so you might want to put it on something soft like, fruit or banana or mashed potato or something where those little fragments will at least get incorporated in there. If you put it on their pellets or seeds, I can just about guarantee you those flakes are going to fall to the bottom of the food bowl and not be eaten. With some of the bird ones, just bear in mind that, they've got all these powders that you can dump on the food. It may or may not stick to the food. The bird may not eat as much of it as we think. And there's little oversight of what's in there. So they may not be able to tell you accurately how much you're dosing the bird. They might not even have detectable amounts of the actual ingredient in their supplements. There was a study a couple years ago looking at human supplements that you could buy at Walmart, and they found a lot of those supplements either didn't have nearly as much of the active ingredient as claimed on the label, if any at all, and some of them had added contaminants that should never ever be in anyone's supplement, like toxic things. So just be careful buying those things. Try to buy from companies you've heard of.
Yeah, I keep asking Lefebvre to come up with a senior advocate too, because that's what my birds eat. I would love to see the same supplements from the Nutriberries in the advocates as well.
I think that would be easy enough.
Yeah. Dawn says, any tips for one-legged footed birds? I put Silvadene on my conures foot every other day. Signs of bumblefoot at last checkup.
Yeah, so one-legged birds, they're going to need the most TLC. They're the ones that are going to need wider perches, larger perches, because they've only got one foot to hold on with. At least with a wide or flat perch, they can use their little stump to help keep themselves upright. They probably are going to need a lot more cushioning as well, especially if they do use their little stump. So they may benefit from rope perches. They're ones where I would definitely wrap their perches in vet wrap or similar material. If anyone out there is not familiar with vet wrap, it's what's called a self-adhesive bandage. It's not sticky, but it sticks to itself. But if you wrap it around a perch, it gives it texture and grippiness, and it's relatively soft, so it'll cushion a perch nicely. That bird is probably going to need a lot of platforms in its cage so it can navigate really well with just their little stump. Sometimes those one-legged birds are better off with just flat horizontal living, no perches or perches that are very close to the ground so that if they lose their balance, they don't fall very far.
Mm.
Go
ahead. Sorry.
If you can, try to save the Silvadene for when we've got some really bad lesions on the foot. Silvadene, it's great stuff. It's what we use as my understanding is human burn patients. It does a great job at keeping the fungal and antibiotic growth down. it is relatively big guns compared to, say, Neosporin. So if you can get away with Neosporin, great. Save the big guns for another day. If that's the only thing that keeps your bird's foot happy, that's fine. But if you can get away with smaller guns, go for it.
Speaking of the Neosporin, before I get the next question, what about Bactroban? Is that safe to use around birds?
I'm not familiar with.
All right, Muciprocin. It's a very common antibiotic ointment. My concern with the antibiotic ointments, the lidocaine issue aside, is if any of them are toxic if the birds were to lick it.
Yeah, at the doses that are present in the ointment, it is probably more likely they get some stomach upset from the actual petroleum jelly component of it, more so than the antibiotic itself. I honestly worry about it more so with like bunnies, where the neomycin component is actually toxic to rabbits. They're probably not going to ingest enough from a little Neosporin to hurt themselves, but still it gives me the heebie-jeebies. We don't have quite that worry in parrots, thankfully.
Okay, great. Janet writes, my bird's foot is curled. Was told she had a TIA, that's a transient ischemic attack, or mini stroke, and also arthritis on 4 medications. What exercises for her?
Well, if she'll let you touch the foot and work with it, you can start by just doing a range of motion exercises. And this is where we open up the toes as far as we can. We don't want to push it to the max, just as much as we can comfortably open them, hold them in that position for a few seconds, then release. Then we do it again and then release. And we want to do like, 10 to 15 reps of this, give it a break, and then do it again. You can do this once or twice a day, and that is geared more towards just keeping mobility of those toes. Once we get nice mobile toes, we can do assisted standing exercises where we have the bird standing on a flat surface and we manually open their foot for them and put the foot in a standing position so their foot gets hopefully used to standing in a normal position again. With birds, we definitely have some limitations on what we can do with those. We're a dog, or we could do a lot of crazy fun exercises to get some leg and foot usage back. If we can get the bird to the point where they can stand with their foot open, we can do exercises where they have to, say if we got them on a towel, make a wrinkle in the towel that they have to walk over. And as they get more comfortable with that, we can put a flat perch, take a wooden dowel, tape a popsicle stick to each end to give it feet so it doesn't rotate, and then have the bird step over and stand on that as they go. Now, with an arthritic bird, some of this might be outside of your bird's reach, but even just keeping up with the range of motion exercises and standing with the foot open can do a lot to preserve some use of that foot.
Oh, that's great.
Okay, thank you.
Jen writes, for a bird that has a leg band, is this part of the annual physical appointments that get looked at? Yep. My Quaker has one, but it seems to be fine.
Yes, we check that out as we're looking at their legs. We're inspecting that leg band, make sure it's the appropriate size, shape, and that we're not getting skin funk built up underneath.
Great. And Gayla says, what is good to put on the feet to keep them hydrated?
I'm a fan of just a good old-fashioned bath. So a couple times a week, get them nice and soaking wet. That'll help to rinse things out from underneath the leg band, whether it be a spray bath, in the shower, playing in the tub, however your bird likes to take a bath, do it a couple times a week.
Great. Candy says, thank you so much. This was so interesting and most informative, much learned by me. Great, Candy. Gayla says, what do you think about taping a washcloth on a wooden perch if you think your bird has arthritis?
I'd be careful with that. The washcloth, you would have to tape it down really securely because it's something that could shift and make for an unstable perch. You would also, especially with terry cloth, those loops can catch toes really easily. Even just toenails can get stuck. Even microfiber washcloths tend to catch toes all the time. They're my least favorite towel to hold a bird with because they just stick to toenails left and right. If you were going to put something on the wooden perch, I'd go for the self-adhesive bandage because at least that's a little less likely to be an entrapment hazard, and it's easy to get that thing nicely, tightly wrapped around the perch so it won't shift.
Great. Maureen says, my senior cockatoo with foot arthritis also has failing eyesight. in his case, is it okay to keep the perches in the same spot? He
Yeah.
loves his flat sleeping platform, and I don't want to move it. We have
Yeah.
several different types and sizes of perches.
Yeah, a case like that with the failing eyesight, I would try to minimize any changes to the cage. If you have to make a change in there, like swapping in a bigger perch or moving a perch, just try to do it as gradually as possible. I mean, this may be in a situation where, say, you need to make one of those perches larger, you could probably start gradually increasing the diameter of that perch by wrapping it with the bandage material and just make it a little thicker every week. Maybe wrap this is potentially where the washcloth could come in handy is, take pieces of fabric, wrap them underneath of the bandage material. You can gradually increase the size of the perch and then replace it with a big perch. That way the perch stays in the same location. The bird gradually adjusts to the idea that the perch is getting larger and larger and more comfortable for their feet. And that will free you up to swap in something bigger.
Yeah, great. I want to point out something, by the way. So I use a heated perch. My old arthritic
Yes.
guys love it. And I do wrap it with vet wrap to
Mhm.
provide more cushioning so they don't fall. There's a new heated perch out, and I actually have this, but it hasn't gotten any use yet, but people might be interested in them. I'm going to put the link in the chat. There's now a flat heated platform perch. And it has sort of a, if you click, I can see it has sort of a varied surface to it. So this is great for your arthritic elderly birds that may have trouble even gripping a round perch, and they can still get the heat. And I can tell you, my birds absolutely love the heated perch. I mean, and I've noticed a tremendous change with their arthritis with that. They limp less, they're much more comfortable. I first noticed this some years ago when I found they were trying to perch on my computer all the time because of the heat. So I said, you know what, I got to get them some heat. And they really just love the heated perch. But until recently, we really only had the one option, which is a great perch, other than the fact that it's really slippery. So you really have to wrap it, because if they fall off that, they're never going back on it again. So the vet wrap's been great for that. Also, so there's not as much direct heat right on the feet. Right. But now there's a new platform perch too. So I think this will be great for a lot of birds.
Yeah. And with those, just every couple days, be sure to touch that perch, maybe lean the inside of your wrist on that perch and check the temperatures carefully.
Yeah.
They're generally pretty bird safe, but if they get a short or something and start to malfunction, you could end up with hot spots. Even a bird that the normal temperature perch, if they're standing on it for extended periods of time, they can sometimes burn. If you ever looked at the consumer warnings that come with your average heated blanket, it specifically says on there, don't use it for more than this period of time because you can burn yourself. She's going to kill me for telling this story, but one of our technicians has actually flashed me where she was showing off the burn on her boob, where she fell asleep with a heated blanket on her chest. And it burned her through her pajamas.
Oh, wow. Yeah. You always want to check your heated every day. I have a heated side panel too, and the birds love snuggling up against that. And you always want to check it. I've had heated perches that got too hot. They also will short out and stop working, and you don't even realize that they don't have any heat anymore. So they do have a lifespan. The plug part, those only last a couple of years. So at one point I had to box them because every 2 or 3 years I have to replace those. So you definitely want to keep an eye on it. I had one that I had ordered. It came and it was so hot that I immediately took it out and sent it back to the company and got a replacement. So you always have to keep an eye on these. The heat does vary with the K&H one. It does vary over the course of the perch. So you will find sometimes the birds will stay on one part more than another, depending on how much heat they want to get. But it is very easy, just like with the electric blankets, to not realize how much heat you're getting till you have a burn.
Yeah. A lot of modern electric blankets have built-in timers that they will shut themselves off after X number of hours. You could potentially plug in your heated perch into a timer. So you can have it set to turn on for a few hours, turn off for a few hours, turn on for a few hours. That way, if the bird spends 8 straight hours on that perch, the perch is only going to be heated for, say, 3 of them.
Yeah, that would be a great idea. It would be nice if they actually had that even built in.
Seriously.
Like I had a bird who, he ended up very sick, and we didn't realize till after he died that he had lymphoma. We just knew he was sick, but we didn't know why.
Yeah.
He ended up with foot burns because he was immunocompromised. Whereas all my other birds get their feet checked regularly, and they've not had a problem with the heated perch. But again, just something to be aware of. Oh, Maureen says, thank you very much. Fiona loves the heated perch, but it's too slippery for Sid. Yeah, the vet wrap. And then every like couple months, I take it off and replace it because it gets a little grody and all that. Heidi says, thank you, very informative presentation. You have some other nice comments here from Bree and other people here. And I just want to emphasize again, this will be, I know there have been some people that were in and out, and some people can stay. It's going to be posted to YouTube, so you can watch the whole thing and review it. I want to bring up, I had the weirdest injury, foot injury. My bird Pepper, who passed away in December, a few years back, I was literally right next to him when this happened. He got toenail caught in something. And even though I was right there and grabbed him, he actually tore the nail off. But what surprised me, and I didn't know at the time, was there was this long skinny thing hanging out. And it turned out, I guess that was the tendon. And I called the vet. I think it was a weekend, so it was probably a couple of days, so I could call the vet. But it was just sort of this raw tissue under the nail. And I had no idea that that would be the case or what that was. So if this happens to anyone, and it basically shriveled up and died off, and he ended up with just the stub. But if you ever see that happen, it's a very, very weird and alien looking to have this soft tissue sticking out. I wasn't sure what I should even do with that. Should I wrap it? Should I touch it? Should I clean it?
Yeah, it's going to look like the world's tiniest little piece of dental floss sticking out.
Yeah, and I didn't know should I clean it? Should I wrap a bandage around it? Do you have any suggestions if something like that happened?
Keep it clean. Definitely keep it clean. It's not often that we can repair such a tendon once it's sticking out. It's tricky enough in dogs and humans, and a little bird, it's practically impossible. But at least keep it clean until we can assess the foot and determine, if we have to remove it, how much do we take off? Can we salvage any of this? But yeah, just keep it clean.
I mean, if the nail is gone, is there anything you can do with it? I mean, it can't survive on its own. It needs a protection around it. So,
yeah, I'm not a fan of trying to put a bandage on them at home because it is just very easy to make them too tight. And if it's too loose, it's just going to fall right off. It's a very tricky balance. So I try not to encourage folks to cover things, especially feet. Try not to bandage them at home because of those risks. And keep it clean. You can always slap a little Neosporin on it, which will help at least it'll give it a barrier between the outside world. It'll catch any dust and dirt and keep the area moist. So.
Okay. Yeah, it was red, but it wasn't bloody per se. So I wasn't even sure what was going on. First thing I was doing was Googling, going, what on earth is this thing sticking out of underneath the toenail? Well, you mentioned styptic, by the way. I keep styptic and cornstarch around. My concern with styptic is if you have you mentioned it with a bite wound, I thought you're not really supposed to put it on skin. Now I know, when my generation, when I was growing up, and my father would cut himself shaving, because razors were very good back then, they put styptic on the face. But it is toxic and birds may lick it. So I thought we can put it on nails, but we're not supposed to put it on skin.
Yeah, styptic and the silver nitrate sticks are not meant to be in contact with soft tissue. That said, if the bird is bleeding that much and you cannot get quickly to veterinary care, I would rather clean up the after effects of styptic powder on tissue than deal with a bird that's been bleeding for 30 minutes plus.
Okay. I mean, you would try cornstarch first, though?
Yeah, if you've got cornstarch, use that. It's at least non-toxic and it can do the job. If it's not enough, go for the styptic. Just try to use it as sparingly as possible. Don't coat the entire toe in yellow powder. Just try to tap on just enough to keep it under control.
Okay, and Nancy wrote, what about Sovereign Silver Gel? I'm not familiar with that.
Not either. Let me look. Let me Google that real quick. Silver gel. Okay, here we go.
Oh.
Okay, looks like a topical spray. Okay. Yes, I mean, silver definitely has antimicrobial properties as a topical agent. So I don't necessarily have an issue with that. I would just be very careful to only apply the lightest amount and try to keep your bird from licking it. Silver does a great job topically for antimicrobial issues, but it can be toxic if ingested to an excessive degree.
Right. In fact, silver was used a lot, particularly when the pandemic started, because they impregnate a lot of things. Like you might have seen some elevators where they put these special coatings over the buttons.
Mhm.
I saw that a lot when the pandemic started, and they're infused with silver because it has natural antimicrobial abilities. And just like at that time, even before the N95s were available, there were a lot of masks that were impregnated with silver threads and things to cut down on microbial
Yes.
exposure.
Mhm.
Bettina says, what would you recommend for a lesser sulfur-crested cockatoo, 280 grams, that is 1 foot, that has a stump where the ties branch off, that has light pink spots on pressure points? The other foot is normal. All perches are vet wrapped.
Okay. Yeah, if it's just light pink spots, I could probably live with that. I don't expect a stump like that to ever be 100%, well, normal looking. Of course, it's not going to be normal, but as long as it's light pink, it's not swollen, I can live with that. I would keep lookout though for it getting any darker pink color. If it starts getting darker pink, that would be a bird that may need to go on some meloxicam. Yeah, it's like if it's any other species, I might put like some sort of protective sock or something on there, but I would expect a cockatoo to have that off in 5 seconds or less.
Right. Oh, one other thing I'd like to bring up, because again, not too long before Pepper died, we noticed he had developed some white spots on his feet and under the wings. And on necropsy, turned out he had actually very severe gout and kidney failure,
Yes.
among other things. We hadn't been able to get blood work on him in a few years. Otherwise, we would have known that. So I would just encourage people, if your bird, especially if your bird hasn't had lab work, but if they seem arthritic, but if you see any little white deposits, make sure you see your avian vet, because if they have gout, there's medication they can be put on that's different from the meloxicam that specifically treats the gout. So just keep an eye out, be aware that gout is a major source of arthritis in our parrots, and to some extent it's treatable, or at least partially treatable.
Yeah, and you're going to see those little white spots, particularly in association with the joints of the toes. So you'll see these little white swellings or nodules. It almost looks like little pimples in some cases.
Yeah. Oh, Heidi writes, a company called Clinical Care makes a vet product called Superclot, fast-acting gel to stop bleeding and numbs pain. It's available at my Safe Bird store.
Let's see.
Google that and find out what that is.
Yep. On it. I left out a T. Superclot. Ah, there it is. Let's see. Oh, it's on Chewy too. Let's see. Why did it say? Ingredients: aluminum, silver, sulfate. Careful with that one. There's lidocaine in that one.
Oh.
So it's the 1, 2, 3, 4. It's the 5th ingredient, but there is still lidocaine in there. So do be careful with that. I would just use the teeniest amount you can get away with, and don't let them lick it.
Yeah, I mean, if animals didn't chew on wounds, it wouldn't be as much of an issue, I'm sure. But
And when we're talking,
you never know how much they're ingesting.
Exactly. You know, if we're talking about a big old dog, it's hard for them to eat enough lidocaine out of that gel to hurt themselves. But when you're a little parrot, it doesn't take much. This stuff does not specify the concentration of lidocaine, so I can't really tell you, what's the maximum amount this bird can eat before it hurts itself.
Wow. Okay, good to know. That's, a major lesson. Always read ingredients. Always. Bree says, you mentioned use lidocaine very sparingly. However, if lido is needed, what percent is recommended?
The highest concentration I've seen in the topical lidocaines that are easily purchased is about 2%, of which, depending on the size of your bird, that's going to be like a teeny dab. With a lot of the styptic powders and such that carry either lidocaine or benzocaine in there, they don't tend to specify the percentage in there. So, in general, if there's lidocaine in there, I would use the tiniest amount you can get away with. Like with the super clot, use only what you need to get that wound to stop bleeding and not a drop more. If anything, I would rather you start with a teeny amount and build up from there if you must. Oh my, okay.
It says African gray, 500 grams.
I mean, if we're talking about the 2% lidocaine gel that's available, that bird would take 0.05 milliliters. That's like not even a drop. If we're talking about a cockatiel, that's like about a fifth of that size. Yeah, that's gonna be the teeniest little micro drop.
Yeah, probably best not to use it.
Yeah, if you're gonna use it, avoid it if you can. If that's what you've got, just try to use the most microscopic little dab of it you can get away with.
Yeah, I mean, the lidocaine is for comfort. It's not medically necessary versus the risk of poisoning a bird. So.
Absolutely. It's nice to not hurt, but it comes with its risk.
Exactly. Okay. Do we have any more questions? You can put them in the chat or you can unmute yourself. I know we've had
I have a quick question.
Yeah.
Okay.
Oh, sorry, me?
Yep.
So, Dr. Sinclair, it's really good to see you. So glad you're part of this. So my question, I think it's a foot perch related question, but I'm going to give it a shot anyway. So I have a Quaker that has night terrors and more recently. And so I discovered that just due to some injuries under his wing. So I'm wondering, is there a perch that's more safer for him in that scenario, or is it really unrelated and wouldn't matter or not in that situation?
Probably something relatively wide and flat, so that if he does take a night fright, it's harder for him to fall, especially if it's a nice wide platform. He'd have to be sitting at the very edge of it to fall off.
Okay. All right. That's helpful. Thank you.
You're welcome. And with any product you find on any bird website or Chewy or what have you, if there's any question of whether it's safe to use in your bird, feel free to email your vet a link to that product so we can look at the label for ourselves and tell you, if it's safe to use. If it's not safe, what options do we have to replace that? So we'd rather you ask and send us a bunch of links than find out the hard way that it was something terrible.
Exactly. All right. A lot of thanks for the presentation in the chat. I won't go through all those. Any last questions before we go? Any last questions or comments? Well, thank you all for coming tonight. Thank you so much, Dr. Sinclair. This is an excellent topic. Obviously, this is a topic a lot of people had questions about. This video will be posted to YouTube, and I'll send the link out when that's done. And I will stop the recording now.